Good afternoon, and thank you again for joining us. You may notice that we're in a different room today, and it's made it a little bit more difficult for us to remain socially distanced, so we will stay masked, adhering to good public health policy, and our tech crew are also masked, and we are all remaining at least 6 feet apart from one another. Today's one of those mixed days again, where we're going to talk about some good news and some bad news. I'm going to start with some of the grim realities of what is going on now. We continue to see high rates of transmission of the disease of COVID-19 across our state. We see those numbers continue to climb, and sadly we continue to see deaths from this tragic event. Right now, where do we stand in the state from a Northern Light Health standpoint? We have 45 individuals who are inpatient at Eastern Maine Medical Center for COVID-19, 3 at A.R. Gould Hospital, 1 at Maine Coast Hospital, 2 at Mayo Hospital, 6 at Mercy Hospital, and 1 at Sebasticook Valley Hospital. In addition, we have 56 people being taken care of at home for COVID-19 by our home care and hospice patients. That is well over 100 individuals being cared for by our health system who are in need of health care for this disease. We are concerned about what we will see after the last holiday week. As we know, after Thanksgiving, we saw a steep increase in the number of cases of COVID-19. And we are preparing for that event as well now after the holidays of the end of December. This is concerning to us, so we continue to ask for the help of our people out in the public to continue to remain diligent. Wear your face coverings when you're out in public. Stay 6 feet apart. Do not gather outside with individuals outside of your own household, and wash your hands repeatedly. We cannot say this enough. Only you can help stem the tide of this pandemic, and we need your assistance. And now I'm going to turn it over to Paul for some good news about the vaccine.
Thanks, Dr. Jarvis. So today marks the day where we start vaccinating employees for their second and final round of COVID-19 vaccine. And so today is the 21st day from the initial clinic that we started, and we're delighted to have employees receive their second and final dose starting today. The effort to vaccinate is a significant undertaking, and we've been very fortunate to have a very engaged group of employees who are informed and eager to be vaccinated, and have worked with us in terms of scheduling our vaccine clinics, as well as our staff who are conducting the vaccine clinics. It's really been an all hands on deck effort. And we're just delighted to be able to offer the second and final vaccine to employees starting today. It's a significant milestone for us and our staff.
Thank you, Paul. I want to reiterate that the mood at the medical center and across all of our hospitals at Northern Light around our vaccine clinics has been very positive and joyful at the same time when we see concern and anxiety over our climbing numbers. I do want to talk about the vaccine rollout plan and let people know that this is based on best public health processes. There's been lots of concern about how this rollout has gone, but as we look at the chaos that many other states have had, we know that we are doing it in the right fashion here in Maine. It is both sound and systematic. There are challenges to administer these vaccines from a logistics standpoint that we have overcome, and that is a good news for us. I ask everybody to please be patient. It will take time before we get to vaccinate everybody because we are limited by the amount of vaccine that we have arriving into our state. But there is a plan, and the plan is being developed and further enhanced. And as each phase of that plan, we will be open, honest, and transparent with you as to where we are right now. So at this stage, we are still continuing to vaccinate employees at our critical access hospitals, our acute care centers, and our medical centers. That is vital to the health safety of our state. Remember, we still need to be open and available to take care of things outside of COVID, like heart attacks, strokes, complications from pneumonia, diabetes, heart disease, and then manage your chronic illnesses as well. And so we need to be here open and ready, and we need all of our staff. It does not do us any good to just simply vaccinate doctors and nurses because they are dependent on other people within our healthcare facilities as well. Your time is coming. Please be patient. When we know the plan, we will let you know what phase you are in and when it will be delivered. All of this is done for your own protection and safety and for the benefit of everybody in the state of Maine. I do want to state that we have been seeing an increased number of people canceling appointments and procedures as they've seen the numbers around the state rise. I want to reinforce that it is safe to come into our facilities. We are taking every precaution we can to help prevent the spread of COVID-19, and that includes vaccinating our staff and our providers. At the same time, we also know that if you delay care, that could be detrimental to you outside of COVID-19. And so please, if you have a doctor's appointment, please call, make sure that you feel comfortable going in. Many of our facilities can do telehealth visits so you can remain at home. And if you have a scheduled procedure, please feel safe to come in and have that done. We don't want people sitting at home suffering. We certainly don't want to see long-term effects of chronic disease, and we want to make sure that we are caring for you. If you have concerns, reach out to us. We are here for you, and we want to make sure that you remain safe. And with that, we'll open up for questions.
Hey, thank you very much, Dr. Jarvis. First off, we're going to go to Owen Kingsley from WABI. Owen, once your mic is unmuted, please feel free to ask your two questions. And make sure to direct us to where you want those questions directed to, Dr. Jarvis or Paul.
Thank you, guys. Dr. Jarvis, can you speak a little more to the significance of the fact that it is early January of 2021 and we now have healthcare workers here in the state that have been fully vaccinated? Could you have ever expected this to have happened so quickly?
I will tell you, if you remember way back in April when we started doing these press conferences, I was very pessimistic about some timelines for vaccine. Most of that was because some of the timelines really made no scientific sense. These two vaccines that we are using now use a technology that allows us to advance vaccinations much faster than we've ever seen before. So am I surprised? Yes, a little bit, because I really thought we'd be talking about the spring. It's wonderful that we beat that deadline of getting vaccine into arms by the end of 2020. Now the challenge is going to be trying to get enough vaccine into people's arms for the rest of 2021.
Thank you. And going forward, how many healthcare workers are you expecting to have this second dose by the end of the day or the end of the week? And at what point are you hoping that all of your primary healthcare workers that have already received the vaccine will have gotten that second dose?
So if you recall, when we launched this the very first day, we anticipated vaccinating about 65 individuals at Eastern Maine Medical Center. We actually wound up vaccinating over 200 because we found that our process was working and that we were able to do so. So all those individuals will get their second dose today. Those clinics are actually ongoing as we speak. For the rest of the week, we will continue that at Eastern Maine Medical Center as well as at A.R. Gould and Mercy Hospital as their 21-day eclipses. And then by next week, most of our hospitals will be also vaccinating for their second doses. And so again, it'll take 3 weeks for us to get through all the individuals we have vaccinated. To date, we have vaccinated approximately 50% of our employees, and we will continue to do first dose vaccinations for as long as we need to make sure that gets done. At the same time, vaccinating providers who utilize our facilities, and then as we work with the state and on the state's plan to vaccinate our community partners, we will be overjoyed to assist in that endeavor as well.
Okay, thank you very much for those questions, Owen. We're going to move now to WMTW. Mary Kate Mannion. Again, Mary Kate, once you're unmuted, ask your questions and please let us know who you'd like to direct your questions to.
Wonderful. Thank you so much for the opportunity. I think this question would be best for Dr. Jarvis. If I could ask, these two variants of the coronavirus, first one seen in the UK, the other seen in South Africa, what does that mean for us here in Maine? Is there concern about the higher transmissibility of these two, and will this hamper vaccination efforts?
So to date, I am not aware that we have had any of those two variants that you discussed in the state of Maine, but we certainly know that they are here in the United States. And it's particularly the one from the UK and its transmissibility is extremely concerning to us. While it has not been shown to be any more virulent, meaning that it's not causing any more moderate or severe disease, if it's infecting more people, we will clearly see more people with severe and moderate disease, which means once again, we're talking about will we have the ability to take care of Mainers as we need to for all of their other concerns beyond COVID? And so once again, the only protection we have right now is for us to remain diligent, wearing our face covering, staying 6 feet apart, not gathering outside our own household, and washing our hands. The vaccine helps, but it is not the end of the pandemic. And of course, we're only in the very beginning of our vaccination stages. As we continue to vaccinate more people, we hope to see that the virus gets under more control, but that will take time. So please continue to do all those good things we've been talking about since way back when, which was just 10 months ago.
Okay, and Mary, do you have a follow-up question you'd like to ask?
I do, if I may, and thank you so much for that, Dr. Jarvis. And just yesterday, over in Massachusetts, their governor was mentioning that they should assume that the new coronavirus variant is in their community. And you sort of touched on all of these good practices to continue, but is that something that you would continue to suggest for folks here in Maine?
Yeah, so if you remember, we've been talking, when the caseload in Maine was low, we still told people, assume that the virus is in your community, assume that the people that you come in contact with have the virus. Just continue to do that. And so it really doesn't matter which strain somebody has. If they have COVID-19, that's a risk to you, your family, your loved ones, your community. And so really, we should all be just taking the measures that we need to do and assume that everyone is infected with COVID-19 and that we need to protect ourselves from them and, more importantly, protecting everybody else around us.
Okay, thank you very much for those questions, Mary, Kate. Next up is Patty White from Maine Public. And Patty, once you are unmuted, please feel free to ask your questions. Give me a second, Patty, to find. There you are.
Thank you very much. So you've vaccinated about half of your employees. Do you know what percentage are declining, have opted not to get the vaccine?
So thank you, Patty. So declination is kind of a hard thing for us to talk about right now, not because it's bad, but because it's difficult to narrow down what that definition is. So we have individuals who have declined the offer to be vaccinated because the second dose may not work out with the timing of their schedule or their plans. And so that's part of our declination. Right now, what we're seeing is very few people who are offered the vaccine are saying they do not want the vaccine. Some are saying they can't have it at this moment when we offer it to them. And then we just simply reschedule them at another time. Right now, it appears that we have about between 10 and 15% of those who have been offered the vaccine at our various facilities are saying that they can't get it at this moment. That's still a much higher vaccination rate and acceptance rate than we're seeing in other organizations, and that's a good thing. And so, as you can tell, healthcare workers feel that this is a very safe vaccine. It doesn't matter whether that's Moderna or Pfizer, and that they are willing to stand up and get it. And if you talk to individuals, they'll tell you that the reason why they are is because they want to not just protect themselves, but they want to protect the patients that they're caring for, their partners, the other healthcare workers around them, and their families. And so that's why we're standing up and getting that vaccine. That's why we're trying to get as many people vaccinated as quickly as possible. But when you have a state with 1.3 million population and visitors coming in and out, it's just going to take time.
Okay, thank you, Patty. Do you have a follow-up question?
I do, thanks. Dr. Jarvis, you said that you've been pleased with how the process is going of administering the vaccine. Can you just tell us, do you expect that you'll be able to pick up the pace, if we have a consistent supply? And what are the pinch points to kind of preventing you from doing it more quickly?
So that's a great question, Patty. And so we are really actually right now in the process of planning for how we can do large-scale vaccination and how Northern Light Health can participate in that. So we are looking at many ways. One is how do we replicate the process that we have done within our facilities, which we feel has been extremely efficient in getting people through a line and getting the vaccine in their arm and doing so safely. And so those plans are under pace right now. And so we continue to do that. We need to scale to a point where we are vaccinating some 50,000 or more people a week in our state in order to get through a reasonable time frame of vaccinating individuals. That will still take months to accomplish if you do the math, but that's the pace that we are looking at. And we think that Northern Light Health can assume a majority of those vaccinations, that we are prepared to be able to ramp up to be able to do that. We also need to make sure that we can reach every corner of the state of Maine. It doesn't do us any good to simply vaccinate the people at our urban centers. We need to make sure that we can get out into our rural communities. And we have avenues for us to do that. We have our home health care agencies that can get out into those communities, and we can partner with those communities to be able to safely deliver the vaccine in those communities as well. So those are the kind of things that are going on right now behind the scenes while we are waiting for vaccine. I will tell you the number one thing that will hamper us getting vaccine into arms is the vaccine itself. Until we get more vaccine delivered to the state of Maine in a more timely fashion, it slows us down. We have the capacity to vaccinate more individuals than we're doing currently. We are ready and prepared to do so. Once that vaccine arrives, we will put it in people's arms. We have shown that we can do that. Maine is one of the top states in utilizing the vaccine that has been allocated to it. And here at Northern Light Health, the majority of the vaccine delivered to us is put into somebody's arm within a week of it arriving on our doorstep. We will continue that pace for as long as we can.
Okay, thank you very much for those questions. Patty, going to move on now to David Horowitz with TV7. David, once your mic is unmuted, please feel free to ask your questions.
Yes, so this one's for, actually both of them are for Dr. Jarvis. So I've talked to some people who've had the vaccine and they said that they felt kind of sick after they got it. What should people be expecting in terms of side effects for the first few days that they might get the vaccine?
That's an excellent question. We'll certainly know more tomorrow after people have had their second vaccination. But for the first one, most people are experiencing the things that we typically see from vaccines. So they might have a sore arm at the site where the injection came in. Some people have expressed that they've had headache and a little bit of fatigue. Some people have had had a low-grade fever as well. We've had a few people with more severe side effects than that, but that has been very uncommon. The majority of individuals felt like they could come to work the next day after receiving their vaccine, and that's good news. We do know from the studies that people experience a little bit more intense side effects after their second dose. So like I said, tomorrow we'll know more from the people who are vaccinated today, and as the weeks to come, we will know more about how that second dose affects people. Most people do very well with this. It is very similar to other vaccines. I will say that when you get those symptoms, it's actually telling you that your body is having an immune response. That's why you have the pain in your arm. That's why you have some of those other mild side effects, is because it's actually your immune response, and that's telling you the vaccine is actually doing what it's supposed to do. And so in some ways, it's actually a little bit of a comfort that maybe the next day you wake up and your arm is sore.
Okay, David, do you have a follow-up question you'd like to ask? If so, wait till your mic is unmuted and then ask away.
Yeah, so Dr. Jarvis, when I've spoken to you during these meetings in the past, you've predicted when the pandemic was going to get worse in terms of the virus spreading with a lot of accuracy. Do you think that this will be the last spike that we have, or do you forecast more in the future?
Unfortunately, I forecast more in the future. Knowing what we know about coronaviruses in general, that they tend to wax and wane within our communities, and we don't expect this virus to act any differently. In fact, we actually expect that it will probably do this in more effective fashion. This virus is very clever at trying to infect people. So unfortunately, even with the advances that we've made in how we take care of people with COVID-19 and now the vaccine, I do think we're going to continue to see spikes ebb and flow as things continue. Hopefully nothing as high as we've seen this winter, but I can't predict that. I will say that some of this all has to do with human nature, right? Cases go down, people feel more comfortable, they stop doing all those protective things that we talk about on a regular basis, and then we see the spike come right back up again. Despite all the warnings, people still traveled during the holiday season this year. In fact, in some airports, they saw normal levels of travel activity. We will see the rebound because of that, counting out 10 to 14 days after the end of New Year's, we'll start to see that spike again, unfortunately.
Okay, thank you very much for those questions, David. We're going to move on next to News Center Maine. Now, I see two Rosalind Flaherty's here. I'm going to go with the first one first. Now, once you see your mic unmuted, if you are indeed the correct Rosalind Flaherty, let me know. And if not, I'll move on to the next one. Maybe you're twins, I don't know. I'm having trouble unmuting the first Rosalind, so I'm going to move on to the second Rosalind.
Hi, sorry, thank you. This question is for Dr. Jarvis. Are you concerned about the supply of the vaccine going forward?
So we've actually seen a fairly steady amount of vaccine coming into the state. Unfortunately, it's less than we had anticipated to begin with. We have heard from the manufacturers, both Pfizer and Moderna, that they do have vaccine and that they have been able to ramp up production. So we're hopeful. I think we'll know a whole lot more next week. This week is a little bit hampered because of the holidays. We know that state agencies needed to close down and federal agencies needed to close down, and they're the ones who are controlling the actual disbursement of the vaccine on both a grand scale and a local scale. So we're hopeful that next week we might see a greater shipment. I'll tell you that The request that Northern Light Health put in for this coming week is much higher than we did for the last week, and so we are hopeful that the federal government will be able to meet that allocation for us. Are we concerned? Yes, because we would like to see tens of thousands of doses brought to Maine every single week so that we could start that mass vaccination. But until we have that happen, we will continue to just roll out as we have been. Unfortunately, it's a slower process than I would like, but I'm happy that we have a process at all.
And do you have a follow-up, Rosalind?
Yes. Have you seen anyone who's come in, has been hospitalized with COVID-19, recovered, has been discharged, and had to come back at all? And if you have seen it, is there a percentage?
Yeah, I don't think I can answer that question for specifically. We certainly have individuals who have been positive for COVID, who have needed to come back because their condition worsened, and then we have people who are positive for COVID, completely recovered, and have come back for other health concerns, not their primary COVID infection. And so, it happens. It's hard for us to discern from a large-scale statistical standpoint where those numbers really are. So it happens. It's not very common, though.
Thank you for those questions, Rosalind. We're going to move on next to David Marino with Bangor Daily News. David, once you see that your mic is unmuted, please feel free to ask your questions and let us know who you'd like them directed towards.
Thank you so much. I'd like to direct this towards Dr. Jarvis. There have been reports of independent healthcare providers across Maine who work in high-risk settings, but have still not received the COVID-19 vaccine. What role does Northern Light Health have in vaccinating these independent medical personnel who are not Northern Light employees?
So we have been vaccinating private practice individuals who have staff privileges at our hospitals, and we've been doing that since the beginning of our vaccine process 3 weeks ago. And so I want to be clear that that there are individuals who are not employed by hospitals who are being vaccinated. The problem, of course, is, again, the same thing that we've been talking about, limited supply. And that's the reason why the state came out with the initial guidance for us that we should be vaccinating individuals who work for and at healthcare at hospitals, because we know that critical infrastructure needs to be in place all the way across the board. We started with those who work in critical care and emergency departments, and then expanded out to other entities within hospitals, and then in the last couple of weeks have been able to have all of our hospitals receive vaccine and begin to do that vaccination. I'm also happy to report that now the state has been able to procure vaccine to go to other healthcare agencies, like some of our federally qualified healthcare systems across the state, and they have also begun to do vaccination. In any case, Northern Light Health will participate in any way that the state asks us to, and we feel that we will play an integral role not only in vaccinating those private practices that do not have hospital privileges, but also the general public at large. So as vaccine becomes available, we will continue to follow the Maine CDC's guidance and provide vaccine to whomever they ask us to.
Okay. And do you have a follow-up question, David?
I do. There's been some controversy nationwide of instances where medical personnel in hospitals have not received the vaccine. They've received the vaccine after, administrative personnel or non-medical personnel. I was wondering if that was occurring in any way at Northern Light hospitals. If cases where administrators or non-medical personnel were getting the vaccine beforehand, before actual medical personnel.
Yeah, well, we have a very clear-cut strategy. Our strategy, like I said, began with vaccinating those who work within our emergency departments and our intensive care units. As I said in the very beginning of our vaccine process, that does not just include doctors and nurses. That include our housekeeping staff, our food service staff, our laboratory staff, because they are going in and out of those patient rooms just like the doctors and nurses are. So we had a very systematic approach to make sure that we were vaccinating those who needed it first. I will tell you that I did not get my vaccine till the end of the second week of vaccines, because in my current role, my clinical role is very limited. So I made sure that those who had a clinical role received their vaccine before I did. And that's really the approach that we have taken. We really feel that we need to make sure that those people who are interacting with the public need to be vaccinated first and foremost, and that continues to be our rationale. Now, are there times when we have vaccinated somebody a little bit ahead of someone else because really it's because of availability? These vaccines are incredibly fragile. Once we take it out of the freezer, reconstitute it, and start to draw it up, we need to use these vaccines in a matter of hours. We have not wasted a single dose, because what we have done is made sure that there is always somebody else ready to take the place if someone is not available to get the vaccine. So yes, you've heard stories of front desk clerks getting the vaccine while doctors have not. Well, that's just because at that particular moment, that was the person that was available to get that precious, precious, precious vaccine. And we did that on purpose. That's part of the chaos that we're seeing around the country in states that have barely used 20% of their vaccine dosages because they weren't able to actually be as nimble as we have been. And this is not just a Northern Light. This is that every hospital across the state of Maine has been able to do that, to make sure that we are using every dose. So I thank you for your question, because I think it's very important for people to understand and for me to be clear that when we're vaccinating, it's because we have a dose that's ready, available, and we don't want to waste it ever. So that's the reason why our process is in place. But I'm happy to say that the overwhelming majority of those people that were in that frontline category have not only been vaccinated, but they're waiting for their second vaccine this week and next week.
Okay, thank you very much for those questions. David, we're going to move now to Amy Brown from WERU. Amy, feel free to ask your questions.
Thank you. And I think both of these are for Dr. Jarvis. First, are any of the Northern Light Health hospitals nearing capacity for ICU beds?
So that's a great question. So the question was about ICU capacity. And so no, we are not to a point where we need to worry about whether we actually have those ICU beds. In fact, at EMMC, where we have the majority of COVID-positive patients that require intensive care, including several that require ventilatory management, we still have capacity. Now, are we challenged? Yes. We're more challenged actually by staffing those than we are by the actual beds themselves. And that's simply a matter of math and the fact that COVID patients require a little bit more extra care on our part, so we require extra staffing to be able to do that. We continue to be able to meet the capacity for both the patients who are positive for COVID-19 as well as for anybody else who requires acute care. At the same time, we've been able to safely keep open our ambulatory practices and meet the needs of people with their chronic health conditions, their preventative care needs. We have continued to be able to provide things like colonoscopies and mammograms, which are oh so important. And once again, I'm going to use this as a plea, and I'm going to thank you for the question. Please do not delay your care for either your preventative services, your chronic disease, or procedures. We are here, we are open, we are safe, and we can help you. So thank you.
And Amy, do you have a follow-up question to ask?
Yes, and this is a little bit outside of what we've been talking about, but I've been hoping for a chance to ask it. The Washington Post reported recently that according to the US HHS, only about 20% of the monoclonal antibody treatments that they've sent to hospitals across the country has been used. So are you aware of whether or not Northern Light Health is using the monoclonal antibodies that they're receiving from the federal government? And if not, why not?
So Amy, that's a great question. So yes, indeed, Northern Light Health at its facilities does have the ability to provide monoclonal antibodies when it is clinically indicated, and we have done so. There are several instances where we feel that has actually been a protective thing in some of the outbreaks, particularly in our long-term care facilities. In fact, I was approached today about if we could assist in a potential outbreak and would monoclonal antibodies be appropriate for that. I will say that there is still a lot of discussion around the country as to what the clinical utility is for these antibodies. And so I think that's some of the challenge that we see not just here in Maine, but also nationwide, is making sure that we're using it in the appropriate time frame and for the appropriate individual. It is not an easy thing to administer. It typically takes about 3 hours between the prep for it, the hour-long administration, and the hour required to monitor the patient after that administration has finished. And so that becomes logistically challenging for many people and many places, but we are using it. We are also partnering with other healthcare agencies in and around our facilities to make sure that they are aware that we do have this capability, and we're sharing it. So here in the Bangor area, we have shared the monoclonal antibodies with other hospitals outside of our system to make sure that we are meeting the needs of our community. So thank you for that question.
Thank you very much, Amy, for those questions. And I believe a late addition, Kelly Bouchard, did have a question she wanted to ask about the follow-up to the percentage of employees vaccinated. I think this question would probably be more apt for Paul, right? Kelly, when you're unmuted, you can go ahead and ask if you'd like.
Yeah, well, it was speaking to something that Dr. Jarvis said. Okay. About 50% of your staff has been vaccinated, I think was what you said. And I wanted to clarify, is that of all Northern Light Health staff? And what number does that represent? 50% is how many people?
So we've vaccinated about 7,000 employees and non-employed healthcare workers. So about 500 of the people we vaccinated up to this point are not employed by us and are medical staff with privileges and other healthcare workers who are not Northern Light employees. So that leaves about 6,500 or so rough numbers of our own employees who have been vaccinated, which represents just a little bit over half of our staff in total. We know that not all of our staff are in the direct patient care setting, and we do have remote workers who continue to work remotely, and those employees have not yet been offered vaccine and will be in part of later phasing as we focus our priority on those at the front line and are at higher risk of transmission of COVID-19.
And this is across the whole of Northern Light Health.
That's correct.
Thank you.
Okay, thank you very much, Kelly, for those questions. Thank you to all members of the media for attending this virtual press conference. Again, those of you who wanted the copy of the high resolution video, your last chance to ask for it, you can just before you leave, send us a message in the chat window. Otherwise, I'd say have a great day.
Thank you, everybody.
Thank you.